Hi, I'm Jan. I'm a registered nurse and a certified diabetes educator at the Conemaugh Diabetes Institute. I'm here to tell you about your blood glucose monitoring kit. Before we look inside, a brief word about the kit supplier and the arrangement we have with them on your behalf. The CCS Medical Company has agreed to supply these kits to our patients free of charge. As part of this arrangement between CCS and the Conemaugh Diabetes Institute, you have signed a form that alerts CCS that you have received one of their kits. After you return home, a representative of CCS will contact you to see if they can become the supplier of your glucose monitoring supplies. There are many manufacturers of these devices, and you are under no obligation to use the services of CCS. Now, let's take a look at what your kit contains. This is a glucose meter, or a glucometer. It's a miniaturized lab that determines the amount of glucose in your blood. Also in the kit are the test strips the glucometer uses. There are lancets, which are very, very tiny needles, and this is a lancing device to hold the lancets. You also get this first-time user guide. This is a great tool because it shows you every step in the process. Use it as a reminder. Also, you'll find a bottle of control solution and a more detailed instruction booklet in your kit. Before we get started, please know that if you have any questions about the things we cover in this video or about your diabetes in general, you can ask your nurse. And be sure that you get an appointment to see the experts at the Conemaugh Diabetes Institute for even more detailed instructions and advice. Let's get started. Again, this is the glucometer, and these are the test strips. The first thing you must do is tell the glucometer which test strips you are using. Each batch of strips is different, so every time you get new strips, you'll have to go through this procedure. Inside your box of test strips, you'll find what is called a code key. It's very important that the code number on this key matches the code number on your strip bottle, which is here. This strip bottle has code 158, and the code key also has number 158. Always check to make sure that these numbers match. Now you need to insert the code key into the glucometer. The code key is inserted here along the side. Always put the code key in with the gold sensors facing the back of the meter. You'll want to check that you have done this right, and you can do that by inserting a test strip into the glucometer. You can see that the readout is 158, and that matches the code on your bottle. Why is it so important? As I said before, each batch of test strips is slightly different. If you use new strips without changing the code key, you're probably going to get wrong readings, and wrong readings can be harmful to your health. Throw old code keys in the garbage and always check the numbers and make sure they match. Now let's take a look at the test strips. This is what a strip looks like. You can touch it, you're not going to hurt it. The gold sensors of the strip go into the machine, and the other end of the strip is what goes into the blood sample. You don't put the blood sample on top, you put the strip into the blood, and the blood is sucked up like a straw. You have to fill the entire gold chamber with blood, that's this section here, in order to get an accurate sample. You can see that it doesn't take much blood for this to work. But it does take some blood, and this is what we use to get the tiny drop of blood from your finger. It's called a lancing device. Let's get it ready. The lancing device can't work until we load a lancet into it. And inside this plastic guard is one lancet. To put the lancet into the lancing device, remove the cap of the lancing device and insert the shaft of the lancet into the opening. It only goes in one way. Just push it in until it won't go any further. Then twist the round protective cap on the top and pull it straight off. And there's your lancet. Now you can put the cap back on the lancing device. We recommend that you use a new lancet each time you test. With the lancet in place, it's time to see how the lancing device works. On the lancing device, you'll see there are numbers from 1 to 5. This setting determines the depth the needle goes into your skin. Number 1 would be used for somebody who has really fragile skin, like a baby. Number 5 would be for someone who has thick callous skin, like a construction worker. The first time you use this, we recommend you set the dial to 3. If you get a large enough blood sample, then the next time that you test, you can dial down to 2. If you don't get a big enough sample, then you can dial up to 4. To use the lancing device, pull back on the barrel until it clicks. When you're ready to prick your finger, you hold the lancing device up against the side of your finger. You don't want to use the tips of your fingers. That's where the nerve endings are and it will hurt. So always use the side. Now put the lancing device against your finger. Hold it firmly and press the blue button. The needle comes out, pricks your finger, then goes back in an instant. So there's no chance of sticking anybody else. Honestly, I felt just the tiniest pinch. These lancets are incredibly sharp and amazingly small. It's nothing to worry about. Now to get that bead of blood, start at the base of your finger and milk it toward the tip until a small bead appears. So, how big of a bead do you need? It doesn't take much. You'll learn after just a few sessions how much is necessary to fill the chamber on the test strip. Here's how that works. Here's that tiny chamber we looked at earlier. I have already put the test strip in the glucometer, so now I insert the end of the strip into the bead of the blood, and look what happens. The bead is drawn into the gold chamber on the strip. When the chamber's full, I only have to wait 5 seconds, and the glucometer will tell me the amount of glucose in my blood. You might think that once you get the reading, you're all done. You'd be wrong. It's what you do with that number that makes all the difference in the world. Write that number in your logbook. If it's high or low, check your log to see what you ate recently. Use that information to adjust your intake. If you use these numbers and your logbook, you'll be on the road to managing your diabetes. If you ignore this information, diabetes will take control of you in all sorts of terrible ways. Sure, it's scary, but with these tools, you can be in control. Now, here are a few final tips. In the hospital, we clean your fingers with alcohol. But when you get home, we recommend you wash your hands with soap and water before each test. Any alcohol left on the skin could make the reading wrong. If you have to use alcohol, make sure your finger is dry before you test. The important thing to remember is your fingers must be clean. You can use any finger. Even though the lancets are very small, your fingers may feel a bit sore, so use the sides of all of your fingers. And a word about safety. Be careful with your used lancets. You don't want someone else getting stuck with your needle. Lancets should be thrown away in a puncture-resistant container, like a coffee can or a bleach bottle, then discarded in the trash. And finally, we can't hope to cover everything about you and your diabetes in a video. We need to work with you in person. So we encourage you to come to the Conemaugh Diabetes Institute for follow-up. There are certified diabetes educators there who can answer every question, even those you don't know to ask. Make an appointment as soon as you can. Please call 1-866-641-3828. Having diabetes isn't easy, but with today's technology and with the help of medical experts, you can manage this disease. Thanks for watching. I hope to see you at the Conemaugh Diabetes Institute.